If you're still dealing with concussion symptoms more than 4 weeks after a concussion, headaches, dizziness, brain fog, or feeling off, there's something important you need to know. This is no longer considered a normal recovery window. And that changes how we approach your treatment. Because at this point, the question is no longer, when will this go away? It becomes, what is actually driving my symptoms? And once you understand that, recovery becomes much clearer. In children and adults, most concussion symptoms typically resolve within about 4 weeks. So when symptoms continue beyond that time frame, we often refer to this as post-concussion syndrome or persistent concussion symptoms. And this doesn't mean something is permanently wrong with your brain. It means the systems involved in recovery, like your vision, balance, or your neck, or nervous system, may not be working together the way they should be. The good news is, this is very treatable. But the key is not guessing, it's understanding the true underlying cause. Before we go further, if you find this helpful, consider subscribing. This channel is part of the Brain Recovery Project, where we break down concussion recovery in a simple, practical way so you can actually understand what's going on and what to do next. And by subscribing, you help us grow so we can make more videos like this and help more people. One of the biggest misunderstandings about concussion recovery is the idea that symptoms come from just the concussion. In reality, symptoms usually come from multiple systems that were affected by the injury. And different symptoms you present with often point to the systems that are involved. So let's break it down. Headaches, for example, are rarely caused by just one thing. They can come from the eyes, which usually present as a frontal headache, the neck, which usually presents at the base of the head and radiates up to the forehead and around the eyes, the autonomic nervous system, which can present many ways, but in regards to headaches, typically presents with a whole head kind of slightly pulsating or heartbeat type headache. And sometimes migraine headaches are triggered after injury, which usually present with a unilateral half of head pulsating headache. Most people only treat one of these or assume it's just post-concussion headache and miss the bigger picture that there could be or likely are multiple causes of their headache. Now, dizziness is even more multifactorial. Dizziness can be caused by BPPV, a simple inner ear crystal issue where a calcium carbonate crystal gets dislodged with the initial trauma and is in an area of the inner ear where it shouldn't be. Now, neck dysfunction often causes neck-related dizziness and or vertigo in addition to headaches and neck pain. Or finally, a mismatch between your eyes, your inner ear, and your brain's balance system also frequently cause dizziness. All of these causes require a different treatment to be successful. So when someone just tries balance or eye exercises without knowing the true full cause of their symptoms, they often don't fully resolve. And this is where most people get stuck. They start doing generic treatments without first understanding what is actually driving their symptoms. So it's important to know that post-concussion symptoms are rarely come from just one source. More often, it's a combination. Vision plus neck plus heart rate and vestibular systems and autonomic nervous system. In this scenario, if only one piece is treated, you only get partial improvement. Now, if this is starting to make sense and you're realizing your symptoms might not be random, go ahead and subscribe. In future videos, I'll break down exactly how to identify which system is involved and what that means for recovery. Or if you want the entire recovery plan right now, there's a link in the video description below. So, what actually helps? It starts with correctly identifying, not guessing. Step one is understanding what symptoms you have, what systems are likely involved, and how those systems interact. Then treatment becomes much more targeted and simple. Visual system rehab is if the eyes are involved, vestibular rehab if the vestibular system is involved, neck treatment if cervicogenic symptoms are present, and autonomic system retraining if your regulation is off. That's how we move from frustration to clarity. If there's one thing I want you to take away from this, understand. Persistent concussion symptoms are not a sign that your brain is broken. They're a sign that your system needs a more specific approach. And once you understand what's actually driving your symptoms, you can build a treatment plan that finally starts moving you forward again. If this video helped you, leave a comment and tell me what you're dealing with most. Are you dealing with headaches, dizziness, brain fog, or something else? And let me know a topic that you want me to cover next. At the Brain Recovery Project, we'll keep breaking this down so you can get back to your life with more clarity and confidence. I'll see you in the next video.